Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Drug actions in the brain. In the brain, they cause antihypertensive action, and they are important for anti-anxiety action. These are useful. Harmful are they can cause hallucinations, depression, and insomnia, mainly because of decrease in melatonin. Now, the for this these are the actions of beta blockers on the brain. So because of this, first we can there are some drugs which are designed not beta blockers but other drugs. We have melatonin. This melatonin is used in jet lag conditions, and it can be used in shift workers insomnia. We use melatonin. Then we have ramelteon. Ramelteon is melatonin receptor agonist, which is used in initial insomnia. Then we have tasimelteon. This tasimelteon is a circadian rhythm blind drug. This will blind, or this will inhibit the circadian rhythm.
thank you and thank you for watching.